Hi TikTok, yes, we're still in the hospital. It's been 58 days today. I wanted to talk about the surgery that my daughter just had. So this was her third surgery. She's had 4 now, but this one was, it'll be 2 weeks on Tuesday. It's called a mandibular distraction, osteogenesis. Basically, what they do, well, she was born with a really recessed chin, like her mandible, her jawbone was like pushed back, and your tongue is anchored in the front, and that was, since her jaw was pushed back, it was pulling her tongue back in the back of her throat, and she wasn't able to breathe very well. Even with support, like oxygen support, she still was struggling to like keep her oxygen saturation up. So we went ahead with this surgery. So basically what they do is they cut the jawbone on each side. So they go in, they make incisions like here and here, and then they cut the jawbone on both sides, and then they separate it a little bit, and they put these like hardware things right here on each side, and then there's a screw that sticks out the back. It's pretty painful. Like, I'm not gonna lie, if you went through it as an adult, it would be crucial. And it's definitely harder on these babies. So basically, over the course of however long, the surgeon says you turn the screws. So there's screws that come out behind the ears, and you just turn those screws, and when you turn the screws, it pulls your jawbone forward. Sometimes they do it if you have an underbite, like they'll pull your jawbone back. I know someone that had that done like 10 years ago. But basically what it does, when it brings your jaw forward, it brings your tongue forward and out of the back of your throat, so you're able to breathe without support. So thank God that she's able to breathe. We turned the screws for 5 days. She was intubated, meaning she was on a ventilator for about 4 or 5 days. I can't remember exactly. And then they extubated her. It was 5 days later. And ever since, she's been on room air and she's been able to breathe. This is her now. That's my little special baby. So I can explain her ears too, because she's got microtia and atresia of her ears. And you can see the screws. She has those on both sides. They stay there until we leave the hospital, just to make sure they're done turning them. But I can talk about her ears and her lower half of her body, because she was born without legs too. So I'm open to talk about and communicate with people that have the same kind of things going on.